Hi, I'm Victor Paiva Barbosa. I'm advised by Professor Dr. Eliete Neves da Silva Guerra, and now I'm going to present our project entitled Effects of PI3K-PTEN-AKT-mTOR Pathway Modulators on the Healing Process of an Oral Mucositis in Vitro Model. Oral mucositis is a common adverse reaction of the antineoplastic treatment and is characterized by erythema and ulceration of the mucosa. It affects about 20 to 40% of those undergoing conventional chemotherapy for solid tumors, between 60 and 85% of patients receiving high doses of chemotherapy, and about 80 to 100% of those undergoing ionizing radiation for head and neck cancer. Oral mucositis impairs dietary intake, the ability to speak, and facilitates the occurrence of systemic infections due to the disrupted oral mucosal barrier. It may cause the necessity of parenteral nutrition, more analgesics administration, prolonged hospital stays, and even may culminate in the cessation of cancer therapy treatment. It increases the cost for oral mucositis management, which can reach $300,000 per patient, according to a recent systematic review, impacting either patients' and public health care systems budgets. The oral mucositis pathogenesis is divided into 5 stages. In the initiation stage, radiation and chemotherapy directly injure cells' DNA, resulting in the death of basal epithelial cells, and there is reactive oxygen species production. In the signaling and amplification stage, there is the activation of transcription factors such as NF-kappa B, which induces pro-inflammatory cytokines production, including those that exert positive feedback and amplify the signal. Then the ulceration is formed, and after a period of time, the wound heals spontaneously. The PI3K-PTEN-AKT-mTOR pathway is related to proliferation, survival, and cell growth, thus it participates in the healing process, and its modulation is a potential alternative to accelerated treatments of lesions. In this study, we used two pathway modulators, curcumin and BVP-PIC. Curcumin inhibits NF-kappa B, an important transcriptional factor for oral mucositis pathobiology, and based on the literature is able to modulate the pathway. BPP-PIC inhibits PTEN, which is an antagonist of the pathway. Therefore, inhibiting PTEN is a way to regulate positively the pathway. Also, it has demonstrated induction of tissue repair and regeneration. So, the aim of this study was to analyze curcumin and BPP effects in an in vitro model of oral mucositis. The in vitro model is composed of immortalized human keratinocytes, primary culture of gingival human fibroblasts, and the addition of 3 stimuli: lipopolysaccharide of Escherichia coli, Porphyromonas gingivalis protein extract, and ionizing radiation. There were 3 groups: one group control, one group treated with 2.5 micromolar of curcumin, and one group treated with 1 micromolar of BPP-PIC. We conducted a viability test. Keratinocytes and fibroblasts were cultivated in 9 replicates for each group treated, and after that we performed an MTT test. Both treatments significantly increased the viability of fibroblasts, a cell that plays an important role in the healing process, and this increase in viability suggests induction of mitochondrial activity and aggression reduction. To evaluate cell morphology, we executed immunofluorescence in keratinocytes. The cells were cultured in 3 replicates, treated, and actin microfilaments were stained by phalloidin and the nucleus by DAPI. Morphological alterations were not observed in the nucleus, however, treatments were able to reduce cytoplasms. It suggests increased proliferation because in actively proliferating cells, the amount of cytoplasm present in relation to the nucleoplasm is less. Immunofluorescence in fibroblasts was executed. The cells were cultured in 3 replicates, treated, and the intermediate filaments were stained by vimentin and the nucleus by DAPI. Fibroblasts treated with BPV-PIC presented high expression of vimentin, which plays a fundamental role in cell migration. In migrating fibroblasts, the nucleus is surrounded by an abundance of vimentin filaments, which extend into the tail of the cell. Flow cytometry was conducted to analyze the expression of cell migration and stem cell biomarkers. In vitro models with keratinocytes and fibroblasts were cultured, treated, and then the flow cytometry was performed, using aldofluorokit and an anti-CD44. Isolated CD44 is a cell migration biomarker, and cells treated with BPV-PIC presented higher expression of CD44. However, there was statistical difference only on keratinocytes. CD44 expression is important because its lack results in collagen degradation decrease, and it culminates in the undesirable healing process phenotype. Conjugated LDH and CD44 expression is associated with increased cell renewal properties. In BBB treatment, elevated conjugated LDH and CD44 expression in keratinocytes, suggesting more stem cells. Scratch assay with fibroblasts was conducted. The cells were cultured, scratched, treated, and analyzed every 12 hours based on the percentage of area reduction of wound closure. Compared to the group control, both curcumin and BBB had a full closed wound at 48 hours. Curcumin group presented significant wound closure only at 48 hours compared to the group control, while BBB significantly reduced wound area from 12 to 48 hours, indicating accelerated migration and repair. Therefore, this study was capable of demonstrating that both curcumin and BBB are able to modulate the in vitro model of our mucositis, causing cell proliferation and healing process induction. The results reinforce the currently available evidence that they could be cost-efficient and effective adjuvant treatments in mucositis management, optimizing patients' quality of life and public health care systems budgets. Here are the references used for this presentation. Thank you so much.